Good evening, everybody. A very warm welcome to you from the Faculty of Pharmacy and Pharmaceutical Sciences here at Parkville campus. My name's Helen O'Keefe and I am the recruitment manager for the faculty, and I'm joined by some very special guests tonight who are going to share their experiences with you. I've got Nikki, Jack and Lola here. So let's get started. My mouse will stop playing up. So firstly, I'd like to take a moment to acknowledge the traditional owners of the land on which the Parkville campus sits. They are the Wurundjeri people of the Kulin Nations. I pay my respects to their elders past, present and emerging, and warmly welcome any Aboriginal or Torres Strait Islander people who are in our audience today. So our program for this evening, I'm going to give you a short overview of our faculty and our campus here at Parkville. Then we'll talk about our pharmacy courses, pharmaceutical science and engineering double degree we'll touch on as well. Then we have some commonly asked questions that our students will chat about. We're really happy to take your questions through the Q&A function. I'll try to answer them live. Now, we've got quite a number of people in here tonight, so if I don't get to them, please forgive me. Also, if you have really complex questions about your particular situation, I'll give you my email so that you can email me directly, because sometimes it's tricky to answer very detailed or specific questions in webinars. So let's get going. So for those of you who are considering studying pharmacy or pharmaceutical science, some of the attributes you probably want to be able to be a good fit for that area, those areas of studies, are to be comfortable with maths, chemistry and biology. If you're really interested to work in the healthcare industry, if you are interested in the human body, in diseases, treatments for diseases, in how medications work, if you want to work in an industry that's really evolving and really dynamic, if you want to have a clear idea of what your career path is going to be, and really if you want to help people and make a difference to society, really great areas of study to consider. The biggest question we get asked is, what is the difference between pharmacy and pharmaceutical science? So essentially, pharmacists are health professionals and they are the experts in medicines and how medicines work in the body. They deal with patients in healthcare settings, so they're dealing directly with patients. They're dealing with other healthcare workers in managing patient care. So you really need to like people and be happy to work with people as a pharmacist. Pharmaceutical scientists are the people who make the medicines. So they're the people who are advancing the science of new and existing medicine. So you might have something like COVID comes along and we need a medicine to combat that. It's pharmaceutical scientists who work on things like that. So pharmaceutical scientists will spend a lot of time in the lab, and they may be found working for pharmaceutical companies. They might be working in labs developing things, as opposed to pharmacists who you'll often find working in hospitals or community pharmacy settings. Now, just a little word about our reputation here. We are ranked second in the world for pharmacy and pharmacology, behind Harvard and above Oxford. So we are very proud of that. And that wonderful ranking is testament to our brilliant teaching, the research that we do here, and also the wonderful graduates that we put out into the world after they've studied with us. So we have been in the top 10 in the world for since 2011. So that's, 13, 14 years. So we're really proud of that reputation. So you're certainly in good hands if you come and study with us. A little bit about the Parkville campus. We are actually the oldest campus of Monash because we were established in 1881 as the Victorian College of Pharmacy and were taken over by Monash probably 25, 30 years ago. We are a single purpose campus, so we just teach pharmacy and pharmaceutical science, located in a brilliant spot as part of Melbourne's educational, medical, biotech precinct in Parkville here near all the big hospitals. And we are also, of course, part of Monash, which is a global now top 50 university. Monash has just gone into the top 50 in the QS World Rankings, which is very exciting. So from a student perspective, it's a really unique study experience to study here at Parkville. If you study somewhere like Clayton, there's thousands and thousands of people on campus. It's absolutely massive. There are 8 faculties located there. Whereas here, as I said, we're single purpose. We're teaching pharmacy and pharmaceutical science. We have a lovely community atmosphere because everybody's studying the same sorts of things. And everybody has a common interest in chemistry. We like to say people speak the language of chemistry here. And we put in a very big effort to make sure that people are having, the best experience that they can. So while you're not having that big campus experience, we have a dedicated student experience officer who is always putting on things, whether it's comedy nights or music or free food or employability seminars or what have you. There's always something going on that you can engage in. We also have a range of clubs that are available here for you to get involved in. Sometimes our students will join clubs or sporting teams with the University of Melbourne as well, which is just up the road. We're located very close to the CBD, so easy to get to by public transport, surrounded by parklands. So while we're really close to the city and to Brunswick, we're also, if you need to get out into nature, you can go for a walk. If you need to see the animals, the zoo is right behind us. So there's lots of green space around us, as well as being, very close to the city. We don't have on-campus accommodation here, but students are welcome to live at one of the other campuses of Monash and to commute. And we do have some students who live at Clayton. The other option is living in student accommodation, which is close by. So the Monash Residential Services people will help students to find accommodation near our campus. They will vet it. They will make sure everything's okay about it, that students are being treated fairly and all of that sort of stuff, and really support the students to find accommodation, whether that is private accommodation in a little flat or apartment, shared accommodation with some other students, or in one of the dedicated student accommodation buildings that are around and about the place. Something I really like about this campus is because it's small, you feel very safe. There's 24-hour security here. So if you are staying back, working back late or studying back late, the security guys are just out the front there. So you do feel very secure. So we have a student population here of about 2,500, and about 35% of those students are international. Something else I think is really special about this faculty is the dedication to innovation in education. So we have a dedicated team of academic staff who are all about improving the teaching experience and the education for our students. So while we are essentially teaching a science courses, they're not boring. We do our best to make sure that our students are developing all of the scientific and technical skills they need, along with all of the professional and sort of soft skills that they need to be successful in the workforce. So there's lots of active learning, things like working in teams, in workshop spaces, in labs, of course. There's a simulations that students do, the sort of role playing that students do. So the pharmacy students do role playing, pretending somebody's a patient and they're the pharmacist, so they can practice their skills. A lot happens around employability. So today, it's actually Employability Week at the moment. So we've had a networking session here this morning, somebody talking to students about networking, somebody talking about entrepreneurship. So we develop things like, your interview skills, your presentation skills, so that you really feel prepared when you're going out and looking for jobs. Industry placements are very important. So all of our courses have industry placements. The pharmacy students also do an internship. So lots of opportunity to get out into industry and find out what it is you want to do and what the workplace is like. And then we have individual skills coaching as well. So coaching around things like problem solving, teamwork, written and oral skills. So we're really trying to ensure that our students come out fully prepared for the workplace and very confident as they move on into their futures. So we'll talk a little bit more about pharmacy. Actually, I might just check if there's any questions. No, we'll keep moving. So as I mentioned, pharmacy is a health profession, and pharmacists are healthcare professionals. They really are the experts in the medicines, and how they work in the body. And wherever you find medicines, you will find a pharmacist there as well. Most health challenges in the world require some kind of medicine or treatment, and whether that's your more traditional things like tablets and capsules and injections, or whether it is something a bit more up to date, and things are changing all the time, things like wearable devices or patches and things like that. Pharmacists are involved in all of it, and pharmacies are often at the heart of the local area that they are, or the local community, providing not only sort of medication or advice, but an array of services, now vaccinating people, maybe blood pressure checks for people. So you really are very much part of the community if you're a community pharmacist, or very much involved in patient care if you're working in a hospital. Pharmacy is very in demand, particularly in regional areas. For those of you who might be international students, it's on the temporary skilled migration list. So you can stay after you can apply to stay after you've finished your qualification and work here. And the graduates pretty much get jobs straight out of university. So 96.2% were in full-time employment within a couple of months after graduating in the last Quilt Graduate Outcome Survey. It's even a little bit higher for international students. So it really is a fantastic option. So some of the careers that our students undertake, of course, community pharmacy and hospital pharmacy, but sometimes people will move into working in pharmaceutical companies. They might work in government organisations. They might get involved in medical research and clinical trials, NGOs overseas. We have a graduate who actually works in health logistics in third world countries. Aged care is another area. Some aged care facilities are now putting in dedicated pharmacists into their facilities. So there are a range of areas that you can get into. So typically it takes 5 years to become a pharmacist in Australia. Most universities offer a 4-year degree, so they'll offer a Bachelor of Pharmacy honours, and then you go off and do your internship and you sit your final exams and become a pharmacist at the end of that. Monash was the first institution in Australia to introduce a Bachelor-Master program. So with our program, you will do your 4-year Bachelor of Pharmacy honours, then you will stay on and do a master's, and during the master's you will do your paid internship before doing your final exams. And this is what the course looks like. So there's probably no surprises here. You learn about how medicines work, you learn about how the body works, you learn about different types of diseases. So you'll see the respiratory and gastrointestinal, endocrinology, cardiovascular. You do experiential placements, as I mentioned before. So you'll go out and be placed in a pharmacy, either in a hospital or a community pharmacy, and get some experience. You do inquiry and innovation. That's some research subjects there in the black. And then your 48-week paid internship at the end. Now, also in that master's, you're doing the applied pharmacy practice and foundation practice subjects as well. And students tell us that they're really helpful in making sure that they are confident to sit their final exam. So that's another advantage of doing this course. Not only are you coming up the higher qualification with the master's, but you're also coming out feeling a bit more confident about your final exams. So a little bit about entry to the different course options. So that Bachelor of Pharmacy, Master of Pharmacy, 5-year degree has got an ATAR of 88.05 at the moment. If you wanted to do the 4-year version, the Bachelor of Pharmacy honours, and then go off and do your own internship under your own steam, same ATAR at 88.05. And we also have a Scholars program, which I'll talk about a bit in a moment, which is a High Achievers program. So that's for the double Bachelor Masters at 97.5. You'll see there is something called the Monash Guarantee, ATARs as well. So the Monash Guarantee is a program that recognises students have been disadvantaged in their studies. So if people come from certain categories, if they're Indigenous, if they come from a low socioeconomic area, if they're financially disadvantaged, they can be admitted to the course for a lower ATAR. So there's information about the, it's also the 4th category actually is particular schools. So you can go onto our website and have a look at the Monash Guarantee and see whether you may be eligible for that. And it just means that you can access the course with a slightly lower ATAR. Your prerequisites are English, of course, maths methods or specialist maths, and chemistry. So a little more about that Scholars Program I talked about, the High Achievers Program. So essentially you do the same program that everybody else does, but you get a $6,000 a year scholarship if you're a domestic student. And you also get invited to a range of academic seminars and different sessions throughout the year, and an annual Dean Scholars function as well. So you get to meet the Dean, who is the head of our faculty. So throughout this program, you get to meet and hear from senior academics and connect with them. So it's a bit of a privileged program for high achievers. Good one to have a think about when you've got your ATAR. If you know that you've done better than you thought you were going to do, and you're in the ballpark of this course, it is a good idea to apply for it. So pharmacy is a global profession, and we want our students to have international experience if they can while they're studying with us. So you are able to go on exchange to our Monash Malaysia campus. So we teach exactly the same course in Malaysia, and you can apply to do that. And we also have opportunities for experience at the University of North Carolina as well. So I'm going to pause here and pass over to Nikki, because Nikki's studying pharmacy. So Nikki, I was wondering if you could tell us which version of the pharmacy course you're studying?
Yeah, I'm studying the Bachelor's with the Master's and the Scholars Program.
Fantastic. And what year level are you in now?
I'm in second year now.
Fantastic. And what made you choose our course?
Well, truthfully, I was really in the toss-up between pharmaceutical science and pharmacy. Big struggle for me to pick between them, because I really did love chemistry and science behind it. But at the end of the day, what really helped me decide was that I kind of wanted to be more involved with the patients. So I wanted to see the people that I was helping actually face to face. Whereas if you did pharm you'd be a little bit more behind the scenes. That makes sense.
Yep,
Yeah,
that absolutely
so
makes sense.
that is why I chose pharmacy.
Fantastic. And what do you think is the best thing about studying pharmacy?
Well, it's kind of hard to pick, like you mentioned. We do have a really tight-knit cohort. So if I talk to my friends who study at Clayton, I know that it's almost impossible to see the same person twice unless you already knew them beforehand. Whereas in my course, you tend to see the same people a lot more, because you often share the same classes and sit at the same table and chat, and making friends is a lot easier that way. And also, I do find that our campus is at a really nice place where lots of food options in the city. And if you want, there are really nice thrift shops up at Brunswick to shop for clothes. And there's also a really nice park if you like nature. Yeah. So those are my two favorite things so far.
Fantastic. Thank you. All righty, we might move on now. So I'm just going to make a mention of our graduate entry pharmacy program. So for those students who perhaps aren't sure they want to do, they might go and do a science degree first and then decide if they'd like to become a pharmacist, or maybe if you didn't get the marks to get into pharmacy in the first instance, we have a graduate entry program. So what that means is you finish your biomed science degree, whatever it is, and then you apply to do a graduate entry pathway. You come in for a summer school. So it starts in early January each year for 6.5 weeks. And then you pathway into the third year of our Bachelor of Pharmacy, Master of Pharmacy program. So the bridge to practice, or summer school as we call it, basically just gets you up to speed from whatever science you've studied previously, to start to be able to apply that to pharmacy. So you'll do that over summer. You'll also sort of overload a little bit in the start of that year 3, and then you're all caught up, and you'll go on and do your honours 4th year and your masters and qualify just as everybody else would as a pharmacist. So that's something to think about if you're not quite sure and you'd like to do something else first, or if you find yourself without the marks to get into pharmacy in the first place. So I'll move on to pharmaceutical science now. So a little bit more about pharmaceutical science. So as I mentioned before, it's all about advancing the science of new and existing medicines. So we know diseases are emerging and evolving all the time, and we need to be keeping on top of those. So we need our pharmaceutical scientists because they are finding the treatments and the cures for these diseases. So it's a really fantastic way to make a genuine impact on human health and well-being, not only finding new medications, but also in improving existing medications that might have terrible side effects for people or what have you, and being able to improve those. So because pharmaceutical scientists are fantastic at chemistry, they're also often found in other areas of endeavour. So you'll find pharmaceutical scientists in areas like the food industry and beverage industry, in the cosmetics industry, agrochemicals, all sorts of things that our students end up doing. So yes, a few ideas about career areas. Skincare and cosmetics, really popular at the moment. We're being asked about that all the time. And I've actually just done a profile of one of our students who she got a babysitting job while she was a student, and it led her to develop a range of skincare products for babies and mothers. So you never know where you're going to end up. Yeah, obviously in pharmaceutical companies, in research institutes, perhaps in international development, in treating diseases in international countries, and even things like paints and coating. So anything that requires a great knowledge of chemistry. So what you study in the pharmaceutical science degree is the full drug discovery pipeline. So right from the basic research, drug discovery biology, through to the medicinal chemistry, the formulation science. As you move through the course, you get to specialise a little bit in whichever area that you're interested in. The first couple of years are standard, and then you can kind of choose to specialise in one of those particular areas. Now, with this course, there's a number of options as well. So there is a 3-year Bachelor of Pharmaceutical Science. So that one is really for students who want to get in, get their degree and get out. We also have a 4-year Bachelor Advanced with Honours. So that allows you to do an honours year. So that one is more for people who are interested perhaps in going on into research, or maybe going on and studying a PhD at the end of it. Or we have our double degree, which is a Bachelor of Chemical Engineering and a Bachelor of Pharmaceutical Science. So that's 5 years, and it's done in conjunction with our friends in the Faculty of Engineering at Clayton. And we'll talk a little bit more about that in a moment. So our students go out on placement. Here's an example of some of the companies that students go to. A very small example, there's loads of them, but as you can see there, there are health industries like the Alfred, Asahi beer, Aesop is creams and cosmetics, Dulux paint. So all sorts of different areas that our students can go on placement in their 3rd year. So I'm going to pass over to Lola now. So Lola, can you tell us a bit about what course you're studying, what year you're in?
So I'm studying the Bachelor of Pharmaceutical Science, and I'm in 2nd year.
Fantastic. And what made you choose that area of study?
So I didn't go straight into this course straight out of high school. I actually did first 1 year in a different course at a different university. Spoilers, it was biomed. And I just kind of jumped in there, and I didn't really have a clear idea of what path I wanted to take right out of high school. And so I just did biomed just because I thought it would open some doors. And it was definitely very helpful. And it helped me realize that if I didn't want to do further education and go on and maybe pursue a doctorate or like pursue on further education, it would be really difficult to find a job maybe with just a Bachelor of Biomedical Science. And so when I heard about the Bachelor of Pharmaceutical Science here, I saw how many like doors it really opened. You can see all the different like companies and everything. It's a really broad range of industries that you can kind of go into. And that's something that really attracted me to the program, was like the promise of having a job afterwards. And it's a really great industry.
Fair enough.
Yeah, it's a really developing industry and everything, which is
And do you
exciting
have an
for me.
idea of what you, sorry, do you have an idea of what you might like to, what sort of industry you might like to go into?
So I'm interested more in industry than research.
Mhm.
I've been having like a little look around through our different like employment like opportunities and like employability week. We get like a lot of exposure to that sort of stuff. I'm probably leaning towards cosmetics at the moment. So I've got a mentor who works at ESOP. I've like been in contact with a number of different people in different like at Ego and everything. And it's really cool to see how like the kind of skills that we learn apply even in cosmetics courses, which is really cool, and in the industry. Yeah.
Super popular. I'm being asked about it all the time, the whole cosmetics thing at the moment. Thanks, Lola. Okay, so a little bit about our double degree in the Faculty of Engineering. So students can do a Bachelor of Chemical Engineering. So engineering's got a whole lot of different areas you can study, but with our double degree, you can only do chemical engineering and Bachelor of Pharmaceutical Science. So it's really providing students with pharmaceutical science skills along with the engineering knowledge to manage the whole product process beyond the lab. So chemical engineers essentially process raw resources into something useful. That's what's great about them. And they can design, run and troubleshoot production facilities, but their training doesn't typically include skills to develop pharmaceuticals and related products. And similarly, the sort of formulation scientists or pharmaceutical scientists can invent and test products like pharmaceuticals, food and cosmetics, but they don't necessarily have the know-how to manage the product process beyond the lab stage. So that's why this is a really great joint venture of two areas of study. And of course, people could go off and just be a chemical engineer in a completely different sphere or just be a pharmaceutical scientist, but most likely I would think that people would be looking to, you know, combine those skills. So again, the job outcomes are in industries affiliated with you know, chemistry, which makes sense, paints, healthcare, construction, petrochemicals, food processing, things like that. So in this course, students alternate their location between the Parkville campus and the Clayton campus. I sometimes get people being a bit worried about that when I'm talking to them about it. Jack, I'll call on you now. How have you found it, the toing and froing between, well, it's year by year, so you're not toing and froing too much, but how have you found it being sometimes here and sometimes there?
That's right. So I'm in my 4th year now studying the double degree. I'm at the Clayton campus. Years 1 and 3, you're at the Parkville campus studying exclusively pharmaceutical science units. And then years 2, 4 and 5, you're at Clayton doing all chemical engineering units. So that just means you're not going between the two campuses in one semester, which could be quite tricky.
Yeah, absolutely. And I always think you're kind of getting the best of both worlds in some ways, because you're having that big campus experience at Clayton, and then you're having the beautiful close-knit campus experience here at Parkville.
That's right, yes.
And what made you choose the course, Jack?
So in high school, I was really interested in chemistry and maths, and I believed that the double degree offered me the opportunity to practice both in an industry setting. I was also interested in the number of experiences that you can get throughout your undergrad studies in order to gain industry experience. So in 3rd year at Pharmaceutical Science, you study a unit dedicated exclusively to high performance liquid chromatography, which is what a lot of industry use. Additionally, there's also a unit that you do in 3rd year, which is called industrial formulation. And that's where you get a real world project to work on, and you're able to share your findings in a group with everyone else, as well as your industry partners. So that was really appealing to me. I was also interested in the internship opportunities in 3rd year through the pharmaceutical science faculty. And that allowed me to gain industry experience before I've graduated.
Fantastic. And of course, doing the engineering side of it, you need to do continuous professional development as well. So have you done some stuff on the eng side?
That's correct. So I believe you need 420 hours for the CPD component. 210 of those can be from non-engineering related activities. So I've been able to do that through my part-time job. And at the moment, I'm seeking an internship for engineering to complete the final 210 hours of that.
Fantastic. And what do you think you might do at the end of your course?
Well, as you touched on earlier, Helen, you don't have to necessarily work in the pharmaceutical industry. You're open to work in many different industries, such as water treatment, energy, oil and gas, etc. So I'm open to many different industries. So I'm having a look around to see now.
Fantastic. Good on you. All righty. Let's keep moving. Okay, so a little bit about the entry requirements for pharmaceutical science. So for the Bachelor of Pharmaceutical Science, a 3-year program, the indicative ATAR is around 83.6. With the advanced honours, it's 88. If you're looking at the scholars program, so we again run a scholars program for PharmSci, you're looking at 97.75. And for the double degree with engineering, you're looking at 85.95. Same prerequisites: English, methods or specialist maths, and chemistry. And again, the scholars program is a similar deal to the pharmacy scholars program, the $6,000 a year paid scholarship for domestic students, an invitation to academic seminars. So you get invited to the Monash Institute of Pharmaceutical Science, runs a range of seminars that you get invited to that you wouldn't normally get invited to, I believe, as an undergraduate student, and an annual Dean Scholars function. So opportunities to mix with the senior academics. Now, there's also a Master of Pharmaceutical Science, which I'll touch on as well. So this is a new degree. It was launched in 2022 and it has been super popular, particularly with international students. So it's basically aims to fill the gaps in the pharmaceutical sector and allied industries, and it's been designed in consultation with research leaders, with major employers, to make sure that we're actually producing graduates that have got the skills that people want and that meet the skills that industries need. So studies involve things like mRNA and vaccine manufacturing, using all our wonderful cutting edge technology. So the technology that we have got on campus is, for whether you're undergrad or postgrad, is the technology that you'll be using in the workplace. I heard today that some of it's actually better than the technology that's in the workplace at the moment. So you'll be right ahead of the game when you qualify. Clinical trials, navigating regulation. There's an industry placement in the masters as well. And so again, if you've done something like a science degree at undergrad level and you're looking to specialise a little bit, you might want to consider the Master of Pharmaceutical Science. Scholarships are always a big question for us. So there's a range of Monash-wide scholarships that you're automatically considered for if you apply for one of our courses through VTAC. There are some faculty-based scholarships for pharmacy as well. So if you go onto the Monash scholarships page, you can find links to all of those. You can filter it for pharmacy, pharmaceutical science, and you can see what you might be eligible for. Also, don't forget that the Scholars Program comes with $6,000 a year scholarship as well. So if you're putting in your VTAC application later on in the year, you might want to put that as one of your preferences as well. So we're going to move over to a little panel discussion. I've got 4 questions, post-COVID questions, that I get asked a lot. And so our experts here, our expert panel of current students, are going to address those for you. So, Lola, is it easy to make friends here at the beautiful Parkville campus?
Personally, I think it is. So we've talked a lot about how it's like a close-knit campus and stuff. It kind of reminds me a bit of like a high school, because especially in like the regular Bachelor of Pharmaceutical Science, you're with these people for the next 3 years. You have pretty much every unit together, except in 3rd year when you pick electives, but you pretty much have every single class with your cohort. And so you really get to know everyone in it between the different workshops and the different lab sessions and everything. You can see pretty much everyone. You'll see always like familiar faces. And so like eventually there's no choice, you have to make friends. Especially when you go into industry, having friends from the course is like really beneficial. It can open up lots of doors for you, having those connections already. Yeah.
Fantastic. Now, another question we get asked a lot is, do you have to find your own placements and internships? And I'm going to ask this one. Has my screen just gone blank? Oh no, it's come back on. So while you are studying here, we find your placements for you. Once you move on to your internship for pharmacy, you will have to find that yourself. So it's like applying for your first job. Now, what happens here is that many of our pharmacy students will already be working part-time in a pharmacy or have all sorts of connections. They will have done placements earlier on, so it's not too difficult for them to find their internship. And in fact, people don't have problems finding internships. Nikki, I'm going to hand over to you. I think you're getting organised for is it your first placement? Can you tell us a bit about how you've gone about doing that?
Yeah, totally. So as a second year, so placements start in second year. So we do 1 week of community placement, which is what I'm preparing for. It's coming up in August. So basically what you have to do is kind of organize your immunizations just to make sure, you know, you're immune against all of the crazy diseases out there.
Yes.
And you're all safe in the pharmacy, and then you get placed in a pharmacy and you work full-time as a pharmacist for 1 week in that second year, which is what I'm about to do in August. But I am already working at a community pharmacy, so the placement will be very similar to what I'm doing at work already, which is the case for a lot of people, actually.
Yeah.
But still working 9 to 5 is different from working a part-time, so that's always good to have that experience. And later in the course, so third year, fourth year, I'll get the chance to do a hospital placement, which is kind of like the same deal, but in a hospital. And also the duration will be a bit longer. So to really kind of feel like I'm a pharmacist instead of someone who's trying to become a pharmacist. Does that make sense?
Yes.
Yeah, but I'm pretty excited. I'm pretty excited for placements. It also helps you decide whether you want to be more community-based or if you want to be more in the clinical setting in the hospital, because they are quite different. Do you want me to talk about that?
Yeah, I was just going to say, and do you know what you might like to do? Like you said that you were kind of tossing up between pharmacy and pharmacy, but thought you wanted to work with people. So does that mean that you're keen to work in a hospital or?
Yeah, so I can't say for certain because I've only been in a community pharmacy, but so far I am leaning towards a hospital, just because I think in the hospital you get more of a variety of challenges, whereas in the community you're more just like dispensing scripts a lot. And which is still fun because you can still talk to patients and really build a relationship with them because there are a lot of regulars. There's one lady that always comes in on the day I work, and I get to have a bit of a chat with her, which is nice. But yeah, at this stage I'm leaning towards hospital, which is more clinical based, and you work with doctors a lot more, doctors and nurses, and you work more as a team to tackle some more challenging cases, which I think will be interesting. But we'll see when I do the placements. I'll keep you updated.
Okay. So with the internships, just to let everybody know, it seems like for the domestic students, many will do their internship more do their internship in a hospital than in a community pharmacy. And it's the other way around, with international students tend to be in the community pharmacies more so than hospitals for their internships. So it just gives you a bit of an idea. Jack, I'm going to ask you, students, how long is a piece of string? Students always ask, is the course hard? And I'm asking you because I know engineering's can be hard.
Yeah, it can be hard at times. There are a lot of expectations placed upon you, particularly around projects and assignments and studying. I have found, though, with the pharmaceutical science and the engineering, both faculties offer what's called PASS sessions, which stand for peer-assisted study sessions. These are sessions which are held by students in their third or fourth year who have previously done very well in the unit, and they offer revision questions. So that's a great way just to be able to practice the skills that you learn in your class, is to answer questions as well as form study groups with your peers. So I found that really very beneficial. Additionally, in my experience, professors have been very open and engaging with consultation hours as well. So you can go in and have any questions that you may have with the content answered.
Terrific. Yeah, there is a lot of support here. University is a bit different to school. Sometimes you've got to go out and look for the help rather than have people asking you if you are okay, or if you're going to get your assignment done on time. You need to be a bit more in control of your life, but there's certainly plenty of help for you if you need it. I've just posted pharmacy.outreach@monash.edu in the chat there while I have the chance. That's my email address. So if you have any questions or if there's things we don't get to tonight, please make sure you email me and I can help you with that. We'll move on to how many hours a week do you actually need to be on campus? This is another post-COVID question I never used to get before COVID. Lola, what about you with your course? How many hours are you actually on campus?
So we've got a really flexible kind of learning schedule. All of our kind of content is covered online. So our lecturers will usually like do videos and upload like written content as well that we read through. And so you can do that in your own time, which is really great if you've got like a part-time job or something. It doesn't like clash too much. And then we come onto campus for workshop sessions, which is where you kind of go through the content and with your peers, you kind of work together to answer additional questions. And then lab or like practical sessions where you kind of get a bit more hands-on in the labs and start to like learn a bit more. So in total, because it's so flexible, if you schedule your timetable right, you can get most of your classes on like 1 or 2 days a week, 2 or 3 days a week, sorry. So I'm on campus about 2 or 3 days a week every week. It can like alternate and stuff on different days, but it's like really flexible. It's really comfortable. You have more time to study and everything. Yeah.
Right. And what about you, Nikki, with the pharmacy?
Yeah, so unlike Lola's course, my course is actually completely structured. So the timetable is very set for me. I don't have a lot of wiggle room. But what helps for that is that I always know when I'm going to be available. Like it's always going to be the same. So it's very easy to schedule work around that and other commitments as well. So last year and first year, I was on campus, I think, oh no, my memory's failing me. I think there 3 days. No. Yes, 3 days, 3 or 4 days a week. So it's Monday, Tuesday, and Thursday. I had Wednesday off, and Friday was lectures, which were also live streamed. So you can choose to do them at home if you wish, or you can come on campus for those. So it's 3 or 4 days, depending on your preference. And this year I'm only on campus for 3 days or 2 days because Fridays are lectures again, which I can do at home or not do at home. So it's 2 days. So it changes between year to year, but I guess it just it builds up, and the structure really helps you because they tell you what to do for each day. So on the days that you're off, you have pre-work to do, and then you come on campus and do your workshops and whatnot. So I think it's pretty manageable so far. Yeah, and I have time to do my own thing as well. So yeah, calculate how many hours that is at your own wish.
And Jack, what about you? What's the workload like for you?
So with the engineering component, you can expect to be on campus around 4 to 5 days a week. So completing workshops, pracs, labs, and etc.
Piece of advice you would give to our participants here, or something you wish you had known when you were sitting in year 12 wondering what to do? Nikki, can I start with you?
Sure. I guess in year 12, I was really, really stressed about choosing something. And I think that might apply to a lot of you because there's so much pressure to choose a course and then like stick with it for 3 or 4 years. But I just wanted to say that it's okay to not know. If you don't know, it's likely that you enjoy a lot of things. So whatever path you choose, you're likely to end up liking it anyways. And even if you don't, there's plenty of opportunities to just switch out of it like Lola did. So yeah, I guess calm down. It's all gonna be okay in simpler terms. Yeah.
It is a tough year, year 12, isn't it? You feel like everything's piled down on you, and then after you kind of get out of it and work out where you need to be, life's much easier. Jack, what about you? What piece of advice or what thing do you wish you had have known?
So it'd probably be just to understand that university is very independent driven in terms of learning. And therefore, if you are confused with a certain concept or topic, it's important that you go out and seek the answers to that. As I touched on earlier, there are lots of opportunities to ask for help through professors, through consultation hours, through past classes. So that would be my advice I would have.
Fantastic. And how about you, Lola?
So yeah, similar to what Nikki said, if you don't know what you want to do, that's fine. I'm a great example of this. You can like fully go into one course and then realize halfway through it's not going to work out for you, and that's totally fine. You can still move into a different course. You can take some time off. You have lots and lots of options open to you. You can use kind of like some of the skills that you've learned, even if it's not like directly units that apply into a different course. You can still use a lot of the skills that you take from other experiences and kind of apply them into your time in a different course, or if you're doing this degree and everything. So there's definitely lots of options that are open to you. If you need to switch out of a course, if you don't know what you're doing, you can pick something and then drop it later. It's not a huge deal.
I'd just like to thank Nikki, Jack and Lola for your time this evening and your fantastic insights and information for our students. It's always important to hear from the people who are doing it. You guys are the experts because you're the ones that are right in the middle of it at the moment. So thanks for that. Thanks to everybody who's logged in tonight. Really appreciate it. All the best, and please do feel free to get in touch if you didn't get your question answered tonight, or if you think of something else you'd like to know about. Okay, thanks. Good night.